Let's congratulate Mr. Narendra Garu, MLA, Ponnur, for an excellent institution, continuing with the tradition of the family and making it a place both for health care and research. Dr. Dakshinamurthy Garu is the senior most physician and still continues to do the work with the same passion and same attention towards the most minute details. And my friend and my friends, both from Ayush and from Guntur. Basically, when the program was announced and CSI involvement was needed, I was into the act. So basically, when I felt that still do physicians need an update on ECG at this moment of time, I felt 2 days back when Raghuram and these people has come to invite me. I felt, people still need ECG update to find out that there is a myocardial infarction or the patient? But it was an eye-opener. Yesterday night I returned to the hospital. There was 2-3 patients, 2 people are waiting for a investigation report. So they came from other hospital. One of the duty doctors in a neurosurgery hospital referred her relative for the complaint of chest pain, and they got an ECG done, which was showing ST elevation in V1 to V4. But they came here for a troponin report. So they were waiting for 1.5 hours in our OP hall for a troponin report. And once they got the troponin report, she has referred that you please go and see the doctor. And by that time, there is a huge ST elevation from V1 to V6. So he was in the hospital. He was in the premises, very close to the ICCU, but by the time he received treatment, it is 2 hours. So once we have given the thrombolysis, but that ST elevation persisted and still persisting. Morning I have seen the patient and came here, and ST elevation is still persisting. So this is the way how that was an eye opener for me, because I was questioning myself why these people are wasting time on telling the patients ECG, when to refer and all this. But that is a eye-opener, saying that how to use the investigations which are available easily and when to present that ECG to the doctor who is coming. They have come with a ECG, they have a photograph of the ECG and everything in this, but they have not shown it just because the doctor ordered only get a troponin and show. If the troponin is negative, luckily the troponin value is bit higher, it is 110. It is normal is around 15, it is 110. That's why the doctor has asked her to see us if it is not 15 or 16, and if it is less than 15 or which is in the normal limits, that patient would have gone home and we don't know what would have happened. So chest pain, ECG interpretation is still the gold standard for making a diagnosis of ischemic heart disease, but a normal ECG does not exclude ischemic heart disease or an angina or a myocardial infarction. So ECG reading still remains the most complicated, most very interesting, and if you like mathematics, ECG is the one we should learn and still learn and keep learning until your death. Until your ECG stops, the cardiologist should be learning about ECG, and we have so many things to learn. I have attended more than 150 classes by the ECG expert of our recent times, Dr. Krishnam Raju. That my interest in cardiology has developed because of his meticulous examination of ECG. He used to have 10,000 ECGs of various complications or heart diseases, various in cardiac, non-cardiac, everything, whatever you ask, he had an ECG with. So the interest on ECG started from 1993 and still continues, and still there are some ECGs which I cannot interpret. I have to ask Dr. Somashekar or Dr. somebody to show what is this arrhythmia, what is it. So that is the extent and greatness of ECG. So the basic investigation for all cardiac diseases, which can, if you are alert, it will give the most valuable information about the patient who has heart disease and who do not have heart disease also. So be aware, be alert, and try to learn, keep learning till your last. Thanks for the opportunity.